Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
You may notice your child sneezing frequently or appearing slightly uncomfortable at times, and it's natural to assume it's nothing serious. However, these subtle signs can sometimes indicate a condition such as allergic rhinitis. As a parent, understanding this condition is crucial because awareness is the first step towards helping your child feel their best. Recognizing that something may be affecting their daily comfort or overall well being allows you to observe patterns, seek guidance when necessary, and provide the right support. In a sense, being informed empowers you to care for your child effectively, keeping them happy, active, and healthy. So join us in this discussion to gain a deeper understanding of allergic rhinitis and learn practical ways to support your child. Welcome everyone. I'm Dr. Samir Saluja from THIP Media, and today we are focusing on a condition that often affects our little ones but can easily be overlooked. We call it allergic rhinitis in children. And to help us understand this condition, we have with us renowned health expert, Dr. Yash Mittal. Dr. Yash Mittal is highly accomplished ENT and head and neck surgeon with specialization in allergy, vertigo, and sleep disorders, known for his clinical expertise, academic excellence, and multidisciplinary approach to patient care, and alumnus of the prestigious All India Institute of Medical Sciences, New Delhi. He holds an MBBS and MS in ENT and has further distinguished himself with an MRCS from the Royal College of Physicians and Surgeons of Edinburgh. His academic journey reflects a deep commitment to continuous learning and specialization. Dr. Mittal is also a certified allergist, having completed the diploma in pediatric allergy and asthma from GRIPMER, India, and earned international recognition from the International Association of Specialists in Allergy, USA. His clinical interests span allergy management, vertigo balance disorders, and advanced skull-base surgery, with focused training in neurology and balance disorder assessment. He brings a unique perspective to ENT practice by integrating evidence-based allergy care with surgical precision. Beyond his clinical pursuits, Dr. Mittal is deeply invested in medical education and healthcare leadership. He has created educational content on allergen immunotherapy and frequently shares insights on advanced surgical techniques, including otological and head and neck surgeries. Further demonstrating his leadership potential, he recently completed a healthcare management program from the Indian School of Business, equipping him with strategic skills in hospital administration and systems improvement. With a rare blend of surgical excellence, academic rigor, and leadership training, Dr. Yash Mittal stands out as a forward-thinking ENT specialist committed to delivering comprehensive patient-centered care while driving innovation in the field of otolaryngology. Dr. Yash Mittal, Tech Media welcomes you, sir.
Good afternoon.
Good afternoon, sir, and thank you so much for your time today. So we know that allergic rhinitis, particularly in children, which we commonly call hay fever also, right? It can turn into a very serious issue if it is overlooked. So to begin this very, very crucial discussion, I'd like to start with a very basic and very fundamental question here, that what exactly is allergic rhinitis and how does it present differently in children compared to adults?
Yeah, so allergic rhinitis, it's one of the most prevalent disorders in any age groups worldwide. So what is it? Allergy basically is a kind of hypersensitivity or hyper reactivity to a certain substance. It may be one substance, it may be several substances. Whenever even a minuscule of amount, even a minimum quantity of this substance goes into the body through the skin, through the nose, it immediately triggers a reaction which depends upon the allergen which is causing that and the route of entry. So now we are talking about allergic rhinitis. So that
Right.
means rhinitis. The problem is there in the nose.
Okay.
So the symptoms which happen immediately after exposure to the allergen are four in nature. So the first is nasal congestion, as in the
Ji.
child or the person, the patient, will tell us that the nose is obstructed for a certain amount of time during day or night time. The second will be nasal discharge, which is not persistent. I will
Oh,
come into the details of that. The third is sneezing, which happens again and again and again for a short while and then it stops completely. And the
okay.
fourth is irritation or itching in the nose or the face. So,
Ji.
as and when a person comes to me with this set of symptoms, without telling me that the problem is permanent,
Okay.
this keyword, this fact is really important that the problem is episodic. It may
Okay.
happen in the night time, it may happen in the daytime, the morning, inside or outside. It may happen around the year, but whenever it happens, it usually lasts for a couple of minutes to a couple of hours only. And
Okay.
later on, the child will be completely normal.
Okay.
This, yes, this kind of presentation is kind of a hallmark for allergic rhinitis. Now, the second part was how is it different in children? So the
Ji.
symptoms generally remain the same, but the exposure, the trigger, the allergen which is causing these symptoms, it may be different in the pediatric population.
Okay. Right. And what would you say are the common allergens, that trigger this particular reaction in children, sir?
So again, there is a huge overlap. There is a significant overlap when it comes to the triggers in adults or pediatric population.
Right.
Today we are talking about children. So the first group of allergens or the first group of triggers in pediatric population is house dust mite. So we have to differentiate between dust and house dust mite. We never
Okay.
use the word dust because
Okay.
dust is like a non-living substance which actually does not cause any symptoms. The
Right.
house dust mite is basically an insect which is very small. There are two to three
Right.
species of that, and it dwells
Right.
in the dust which is found in our households. That
Right.
means the indoor dust. The
Okay.
sources of this house dust mite are, the linen, the carpets, soft toys, mattresses, curtains, and
Okay.
it is generally causative of symptoms which happen in the morning and it is
Okay.
a cause of perennial allergic rhinitis. The
Right.
second most common group of allergens is insects.
Okay.
So these insects are cockroaches, housefly, mosquitoes, and ants. Now somebody might tell me like I have not, I'm not getting bitten by a cockroach or a housefly on a regular basis. Then why am
Right.
I symptomatic to it? So I tell all my patients that you don't need to be in physical contact with that insect particularly.
Okay.
The presence of these insects in a room, in a household, is
Right.
itself a positive factor for allergy because their sheddings, their particles, if they are crawling in your room and they're not even present with you,
Okay.
they are mostly invisible to us. They dwell in the crevices, they dwell in the drainage pipes. You can't see them, but they are there. So that is the second group of allergens. The
Right.
third is pollen grains. So we
Okay.
might have written our biology textbook about pollination, how the
Right.
plants and the trees reproduce. They release
Ji.
certain antigens. They
Ji.
release certain particles, which are known as pollen grains. It may be released by grasses, weeds, or trees. Any kind of
Right.
plants. They are
Ji.
generally seasonal in nature. The pollination season for the plants now, inadvertently, humans get in contact with them when they go outside. They breathe in the air, they breathe in the pollens, and
Right.
nose is the first route of entry for them. So,
Okay.
the seasonal allergic rhinitis is caused generally by pollen grains and sometimes
Okay.
by the fourth group, which is fungus.
Okay.
So, this fungus is the mold which we see on our walls.
Right.
So, We are not that stringent when it comes to our housing protocols in India, but in the US, mold is you can't buy a house which has mold. It has to be treated first. Yes,
Right.
it's
Right.
a very common, the fungal spores, the seeds of the fungus, the spore particles of the fungus which are released for their reproduction, they are a cause of allergy in us. And there are different species to that also. It has to be identified which fungus is the patient sensitive to.
Okay.
Now, the fifth group are our beloved pets like cats and dogs.
Right.
The dander of the cat and dogs, that is also allergic to a lot of children.
Okay.
So, an early exposure to pets is generally avoided in children. It is better if there is a familial predisposition, if the child is showing symptoms of allergy, but you can't place why they are happening. So, you have
Right.
to get tested for, pet allergy also. And then coming on to the last common group is the food allergy.
Okay.
Now, food allergy is the one group which is different in adults and children, because children are sensitive to a lot of food items like milk, eggs, peanuts, but most of them grow out of it.
Okay.
Oh, yes. And shellfish is another group. Shellfish means crustaceans, the prawns, crabs, squids. If they are
Right.
allergic, if they are the cause of allergy in a child, they generally don't get cured themselves and they stay for the whole life.
Okay.
So these are the common groups of allergy in children.
Okay. Right, sir. And like you just previously mentioned in one of your answers, that the allergic rhinitis is the allergy that affects the nose of the child.
Right.
So I'm sure parents, especially who are working parents, they might get confused in terms of the symptoms of this nasal allergy with other conditions that affect the nose of their children. So just for them, how can parents differentiate between allergic rhinitis and common cold? That is the most, prevalent condition amongst the pediatric population
Right.
in children, of course.
So common cold and allergic rhinitis. If I just ask the parents in one line, what is the
Yeah.
problem? They'll tell me the
Okay.
same thing in both the conditions. There is
Yes.
irritation in the nose. There is nasal discharge. The nose is
Right.
runny. There is itching. There is nasal congestion. But I have
Right.
to go into a bit of detail. So the
Yes.
characters of the symptoms is what differentiates them.
Okay.
Coming to the basics, common cold is generally a viral infection. It is
Okay.
caused by certain viruses like rhinovirus, coronavirus, RSV, adenovirus, and it is generally resolving spontaneous. It resolves spontaneously. You just have to
Right.
support the child, give him antipyretics, as in fever medication if there is fever. You have to give nasal decongestants. You have to give steam inhalation, adequate hydration, and just reassure the parents that it will go away. No need
Okay.
of antibiotics. No need of any other drastic measure.
Right.
On the other hand, allergy does not go away. It comes, it hits you for about 30 minutes to 1 hour, it goes back,
Right.
and then it happens again when the exposure is there. So
Okay.
the symptoms are episodic, short
Okay.
lasting episodes, which are recurrent, and they have a temporal correlation, as in they are always related to the exposure of the allergen. Without the
Okay.
allergen, without the trigger, the allergic episode will not happen. It may not be
Right.
very well visible to us, but it will definitely be there. So that is the difference between a common cold and an allergic rhinitis or any kind of allergy.
Okay, right. So I think the parent needs to recognize or identify the trigger that is bringing out that particular reaction in their child. Just in simpler words, to identify the difference between the two conditions, probably.
The onus is not just on the parents actually, because
Okay,
it's a bit difficult for a lot of clinicians also. If
okay,
if in food items, or if there is allergy to any drug, any
right,
any medicine, then the
right,
parents can tell you that, okay, whenever the child is exposed to this kind of food item, my child is
right.
getting that symptom. But
Okay,
we have several tests which can be done which tell you that the child is sensitive to this kind of allergen or not.
okay, right,
So the responsibility is both of the parents and the clinician to identify
okay,
that allergen. But the nature of the symptoms, the episodic nature, recurrent nature, that is what helps you differentiate between an allergy and a common cold.
right. Right, sir. And now coming on to two very interesting terms that we come across on Google, which are associated with allergic rhinitis. That is the seasonal and perennial allergic rhinitis. So, sir, what would you say are the differences between the two in context with the pediatric population?
So the difference, the meaning of the words itself, seasonal and perennial tells you a lot. Seasonal allergic rhinitis is caused due to the pollen grains and fungus, as I told before. The
Yes,
pollens are the most common cause of seasonal allergies because every tree, every plant has its own, life cycle. It may release its pollens in the in the months of November, December, January, February, March. These are the most common months when the peak pollen season is there for a lot of plants and trees. That is
right.
why a lot of patients tell that my symptoms are exacerbated during the winter season.
Okay, right.
Cold, it's the winter season, the cold, the dryness itself is a factor which increases the symptoms, but mainly in an allergic patient, that increase in the symptoms is due to the pollens.
Okay,
So
right.
that is about seasonal allergic rhinitis. And also the symptoms will be mostly outdoors if it is due to pollens. So we
Ji,
ask the patients that your symptoms, do they happen round the year or in a particular season? And
ji,
also, if they happen while you're inside, inside your house, inside your office, or when you generally take a walk in your garden or go outside. So some patients will give you that kind of history. Perennial allergic rhinitis is something which happens round the year. That patient will not tell you that I'm getting the symptoms mainly in the summer or winter months. These symptoms may be happening daily or weekly or even monthly, but there is no seasonal predilection in this category of perennial allergic rhinitis, and it is caused by the two most common groups like house dust mite or insects, or maybe fungus also.
okay, right, sir. And now again, something from a parental point of view. Unfortunately, sometimes the time constraints or the stresses of life, they don't let parents reach out to the doctor on time. And, that leads to, the child in the meanwhile, would actually undergo some silent sufferings.
Right,
Unfortunately, with the psychology of a child is that he or she may not be able to explain their problems properly,
right.
and the problem would exacerbate. So, can allergic rhinitis, particularly in childhood, it leads to asthma or other chronic respiratory problems later in life if, I would say, neglected.
Yes, so for that we have to understand the unified airway concept. So,
Ji,
as allergists, we consider the airway as a single organ which
ji,
starts from the nose, it
Hanji,
goes into the throat, then the
ji,
windpipe, then the
ji,
divisions of the windpipe or trachea known as bronchi, and then into the lungs. In the
ji,
lungs, there are small globules known as alveoli which are responsible for the gas exchange. So, from the
ji,
nose to the alveoli, this allergy may affect the child anywhere.
ji,
Now, nose is our, the border, the army, which takes in all the allergens for the first time. It is the primary fighting organ for the allergens or for any kind of toxins which come into our body through the air. So,
ji,
allergic rhinitis is the most common disease when it comes to allergies, respiratory
Hanji,
allergies.
Hanji,
But in a lot of children, it will increase in severity, and in almost 30% of patients of children with allergic rhinitis, 30% of those children may develop asthma. This is the international consensus that asthma and allergic rhinitis are heavily correlated. So in
Hanji,
30% of the children with allergic rhinitis, asthma may be there, and in 70% of bronchial asthma patients, allergic rhinitis is found. It's a huge correlation, and it's also well known that early and correct treatment of allergic rhinitis reduces the occurrence and the severity of bronchial asthma. So it's very pertinent to identify these symptoms at an early age so as to prevent their progression into a much more serious problem, which is bronchial asthma.
okay, right, sir. And if a child is going through this allergic issue, uh, you know, would that child be facing some learning or sleeping difficulties?
Yes, so imagine a 5-year-old child who's constantly irritated by a runny nose, whose nose is congested. He's just rubbing it like this again and again. The eyes are
Yes,
watery. He just wakes up in the morning and starts sneezing. He's appearing for his or her exams, at 10 years of age. And during the examination, some kind of dust exposure is there, and he starts sneezing. The peer group is a bit irritated, like, why is this guy sneezing a lot? Why is this guy always having itching in the face? Why are his eyes red? So it creates a bit of a problem for a child. It's difficult to socialize for that child. It's difficult to concentrate in the studies for that child. And after a certain point of time, you just start avoiding social contact due to embarrassment. That happens in adults also, but in children you can't identify that very easily.
right,
And coming on to sleep, so sleep is, the natural sleep. The healthy sleep is when you are taking in your breath through the nose. Your nose is working fine, you are breathing through the nose, and you are sleeping peacefully. If your nose is obstructed permanently or chronically, and you're not able to take the breaths in, you start waking up at night because of choking. You have to breathe through your mouth. So that is what is obstructive sleep apnea. That's a whole different disease. But nasal pathologies are like really responsible for obstructive sleep apnea like symptoms. So yes, allergic rhinitis does affect the learning ability of the child and affects the sleep a lot.
right. And because the condition is affecting the academic performance of the child and even, a healthy sleeping pattern, when would you say that, should parents consider seeing a specialist like yourself for their child's persistent nasal allergies?
So the answer to this question is that if the daily life is getting affected from the
Right.
disease, or
G.
if the child is developing new symptoms. So to go into the details, allergic rhinitis is divided into two categories: mild or moderate to severe. So the mild variety is when the symptoms are there occasionally, but they are not affecting the quality of life. The child is going on living his or her life comfortably. There are no leaves of absence from school. He's performing well in the school, but sometimes he's sneezing, sometimes he's getting irritated because of certain exposures. And at that time, we can just avoid what is causing these symptoms. We can do home remedies, and that's fine. Not every child has to be brought to the hospital. But if the performance is getting affected, if the child is not able to concentrate, or if the problem, which was a bit mild in the past, is getting more and more severe,
Right.
like there are systemic symptoms of allergy too. Like sometimes the patients get swellings around their eyes or the lips, which is known as angioedema. Sometimes
Hmm.
there is a life threatening reaction also known as anaphylaxis to certain food or drug allergens. So in those
Right.
cases, definitely you should see a specialist for a patient of allergy.
Right, right, Sam. And like you just said that it's very difficult for even the doctors to differentiate or identify the allergic triggers, particularly in children.
Yes,
And you probably would be needing a couple of diagnostic evaluations to
right.
determine them. So, what tests would you commonly use to diagnose allergic rhinitis in children?
So for the diagnosis, the first thing is to ask several questions to the parents, like what I told you. When are the symptoms happening? What are the kind of symptoms which is happening? When are they happening? Like, is there any particular history of exposure to certain allergen? Then
Right.
we have certain markers, like a child who's allergic will have certain visual markers. The eyes, the area, the skin around the eyes may be a bit dark. There is a groove which forms on the nose due to constant rubbing like this, which is known as allergic salute. The turbinates, there are some tissues in the nose which are
Okay.
normal sized in
Mm-hmm.
people who are not allergic, but in somebody who's allergic, the turbinates are increased in size, and there
Okay.
is watery discharge which can be seen in the nose. So all of this you can see during the examination only. Then as ENTs, we regularly do endoscopies of the nose so as to see again the turbinates and the kind of discharge which is there. There are certain other markers of inflammation or allergy. Then there is a blood test which comes, which tells you about the count of IgE antibodies. Now, IgE antibodies are the chemicals in your body responsible for these allergic symptoms. So the
Okay.
level of IgE, it it might tell you that allergy is there. It is not at all a diagnostic test. A lot of patients come to us with the IgE levels being high, and they tell you on your face that, see, I have allergy, now you have to reduce these levels. No, that is not the proper diagnostic test. The best test to diagnose allergy is a skin prick test, or allergy skin testing. So
Okay.
what do we do? What we do is we inject several allergens which we think might be positive for the symptoms. We introduce the
Okay.
allergens like very small drops on the forearms or on the back, and we
Okay.
see a reaction which might form to those allergens. So
Right.
it tells you in a live manner that, see, this exposure to a small amount of allergen only is causing such a severe reaction. We measure those wheals and flares which happen, and that tells
Right.
you if the allergy is there or not, and also what kind of allergen is causing these symptoms. If for some reason allergy skin testing cannot be done, like the child is very small, the child will not cooperate. If the parents are worried, like, I don't want my child to get injected with so many chemicals, although it's a very small injection only in the subcutaneous part.
Yeah.
But in those cases we can go for a blood test which tells you the specific IgE levels, the
Okay.
levels of the specific antibodies which are there.
Okay.
So the IgE antibodies are specific to different allergens. So
Right.
if any particular allergen is coming highly positive, then we
Right.
have indication like, okay, this child is sensitive to this allergen. Now I have to correlate the history which has been given to me by the parents, and then we take a decision if the child is allergic to that particular allergen or not. Because believe me, a lot of times you'll get sensitivities to, you know, half a dozen of allergens, but all of them are not responsible for the symptoms in your child.
Okay. Right. Right. And I'm sure for the ones who've been diagnosed positive with, nasal allergies or allergic rhinitis, uh, 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 are there any specific guidelines for managing the condition in infants and toddlers, sir?
So in infants and toddlers, again, you have to go by a step-by-step approach. You have to ask your questions, you have to do your tests, and the
Right.
first treatment is always like prevention of exposure to the specific allergen which is causing the symptoms. The child is also given nasal corticosteroid sprays and antihistaminic tablets or syrups to decrease the symptoms.
Okay.
If the symptoms are persistent, and if the parents are, agreeing for a treatment which goes for a longer time, we can go
Right.
for allergen immunotherapy. Yeah.
Okay, right. And now for the well-informed parents, the ones who usually, read a lot. There's another term in context with allergic rhinitis, which we come across on Google, is allergen immunotherapy. So, sir, please help us understand what does the allergen immunotherapy mean, and is it helpful in managing allergic rhinitis in children?
Yes, so allergen immunotherapy, first of all, we have to understand what is immunotherapy. In
Okay,
allergen immunotherapy, what we do is we introduce very small amount of the allergen which is causing the symptoms. Now, you'll ask me, why are you giving the trigger when you are telling again and again that you have to avoid those exposures? We are
right,
training the body to get exposed to that particular allergen in a very small amount, and then we will be increasing the dose and the exposure over a long
right,
period of time. We are
right.
training the body not to react to it. It is
Okay.
not just something psychological or a placebo. There is
Right,
a proper immunological mechanism that
right.
the antibodies which are formed in response to that exposure, the kinds of antibodies which are formed changes over a period of time. If
Okay.
the exposure is done in a graded and a slow manner. So what we do is, if a particular child is sensitive and allergic to XYZ antigen, we will
Right.
introduce that through a sublingual or a subcutaneous route. So the
Okay.
allergen immunotherapy may be in the form of drops, which you have to put below the tongue in the oral cavity in the mouth, or it may be injections which are given by a clinician in the clinic or the hospital. The
Okay.
dose is increased very strategically. We guide, we understand, we make our patients and the parents understand about the exact dosing schedule when they have to follow up, and we teach them how to take the therapy at home only.
Okay.
Usually it comes in a bundle of 3 to 4 bottles which go on for about 5 to 6 months, and the complete allergen immunotherapy takes around 2 to 3 years to complete. Now, if the therapy is completed for the whole duration in a proper manner, the effects last almost for 8 to 10 years. It's a significant time for a
Right.
child who's, let's say, about 7 to 8 years of age. So the whole adolescence, the whole childhood is, free of allergic symptoms.
Right.
The disclaimer is that the allergy does not go away completely.
Okay.
We cannot cure it 100%, but the
Okay.
frequency and the severity of the symptoms is significantly reduced,
Okay.
but only after a proper selection of the allergen which has to
Right.
be given to the child. So that
Okay.
is the basis of allergen immunotherapy.
Okay. Right,
Yes.
right, sir. Right. And like you just said, that even after introducing that particular allergen, the impact would be gradually reduced, but we cannot completely eliminate it. Then
Yes.
I'm sure you would recommend a couple of lifestyle or environmental modifications just to, balance the allergen symptoms so that the child can actually, dwell well with the home and the school environment. So, sir, what would you suggest?
Right. So the preventive measures also depend upon the type of allergen or the trigger.
Okay.
We talked about 6 groups, the main 6 groups of allergies. So coming on to the first group, house dust mite.
Right,
So house dust mite, as I told, it dwells in the heavy linens or the clothings like carpets or mattresses or curtains or soft toys. So
right,
exposure to those has to be reduced to minimum.
right.
Carpets have to be removed from the house, or at least from the room of the child. The
Ji,
curtains should be light and not, multi-layered, those multi-layered big curtains.
हाँ
Soft
जी,
toys have to be removed.
जी,
Then using a broomstick, like brooming the room, which creates a lot of dry dust which is dispersed in the air, that has to be avoided. And wet mopping can be done on the floor or the surfaces. There are also mite proof mattress covers.
okay,
So as I told, the house dust mite, it dwells in the mattresses also. It's a very small insect. The length and the breadth is just same as the width of a human hair. You can't see it.
okay.
Yeah. So mite proof mattress covers are available in India, but they are a bit expensive. At least 20,000 rupees. So if you can afford them. So these are the prevention measures for house dust mite.
Okay,
For insects, I always tell my patients, try to get professional pest control in your house at least
okay,
3 monthly.
okay,
What you can also do is you can use pesticide sprays like HIT or those other sprays at least in the corners and the crevices. Shut down, close your windows. Do not let the mosquitoes enter your house, because in multi-story buildings, insects are almost always present. So that
right.
exposure also has to be prevented.
Oh, right,
Now,
right.
mold has to be treated at the earliest in any child, even if there is no symptom also in any toddler. That exposure has to be prevented. So mold
Right,
is to be avoided in a child, in a house in which young children are there at least. Then
ji,
comes the food allergy. So if the parents have seen that the child is getting symptoms after exposure to this particular food item, the child does not have to eat it, and it has to stop coming to the dining table where the child is eating also, because the transcutaneous exposure, like the exposure of the food item, even through the skin, even that is causative of allergic symptoms. So the child has to stay away from those food items. And
Right.
coming on to the pollen grains, it's a bit difficult for any exposure prevention, because you will go out, the child will go out and play. You cannot stop breathing in the air.
Right.
But when it comes to the pets, if the child is found allergic to cats or dogs, it is advisable to not let the child be anywhere near the pets, and the best option is to just not have that pet in your house.
Okay, right, right, sir. And Abhi, thoda sa, I'm going to ask something very important yet ignored most of the times. Are before getting into the cycle of successful treatment for any particular condition is the acceptance.
Right,
And we live in a place where we come from different social backgrounds, cultural differences. So I'm sure there might be certain roadblocks even for you as a practitioner, as a consultant, in convincing your patients कि हमें कैसे हो सकता है वाला जो एक हमारा आता है ना एक फैक्टर. So
right.
sir, have you ever come across some myths and misconceptions about allergic rhinitis in children, that parents should be aware of and you would want to combat?
So, first of all, like you're very right. First of all, the problem is in the acceptance. Like my
Yes,
child, how can my child have this kind of problem?
yes,
In India, in our nation, anything which is named, any illness which is named, there is a huge stigma against that. Like how can this doctor give this diagnosis to my child?
yeah,
That is there. The knowledge is seen as a negative, uh,
yeah,
negative aspect of the treatment, the knowledge
yeah,
of that named disease. the
ji,
second the second thing which I face is that allergy is always told to be permanent. Allergy is always told to be untreatable,
yeah,
uncontrolled. You can just put your nasal drops, you can just take your tablets, you can just take your steam, but tomorrow or the day after it will come back. So coming on
yes,
to the first point, the acceptance of the disease. If the child is allergic to any food item, it is very difficult for clinicians, for anybody to tell the parents that your child cannot have this thing, your child has to avoid milk, your child has to avoid eggs.
yes,
But at the cost of causing the symptoms, it is generally good. It is generally advisable to avoid those allergens. What
right,
should be done is you have to consult a dietitian, you have to consult a pediatrician when it comes to food allergies,
okay,
so that you can know, so that you can tell the parents that if this particular food item is to be stopped, there is a replacement for the same nutritional value.
yeah,
The second thing is the notion that allergy is untreatable. Yes, I understand allergy is a tendency of the body to have those symptoms, and it will not go away completely. Now,
yeah,
the keyword is completely. If you can reduce the symptoms by even 50%, by even 80%, it is a huge gift to the patient, because if the symptoms are happening in once in a while, once in 1 month, once in 2 months, it is not at all problematic. So we
ji,
have to tell our patients that with the appropriate diagnosis and the appropriate prevention measures, along with the allergen immunotherapy, most of these cases generally get their disease controlled very well. But
ji,
you have to be patient with your step by step approach. And
ji,
if you start on if you start on immunotherapy, if you start following the exposure prevention measures, it takes time. Just hang in there. But
ji,
the the advantage of all this will come. So
ji.
this notion has to be instilled in the parents and the patients.
Right. Right. So conviction is the key here, that
Yeah, dedication and the connection.
yeah, so you need to make them understand that the treatment is always a gradual process and probably they will have to put in their input to make it 100% success there. Right, sir.
Yes.
So, so in the similar vein, why is it important for parents to improve their health literacy when you will be managing their child's nasal allergies or allergic rhinitis?
So I've heard from somewhere, the patients are the best doctors for that particular disease.
Ji,
Similarly, the parents, they will give you the best the best pointers for the diagnosis. They will tell
जी,
you the best, the most useful things to help
जी,
you. You just have to listen to them. So the literacy which has to be there in the parents is the acknowledgement of the symptoms which might be
जी,
happening. An
जी,
occasional sneeze or occasional runny nose, it's fine, but we have to understand if the child is suffering through those symptoms severely,
right,
and the prevention of exposure to certain substances like fungal mold, which I told dwells in the walls, the
right,
exposure to food items quite early in the age, if there is a history of reaction to that particular food item. So that kind of literacy, that kind of knowledge, if it is there in the parents, it makes the job much easier for the clinicians also.
जी, जी, sir. So I suppose parental observation and vigilance is what would you suggest are the best health
Right.
literacy aspects, right? So on that beautiful note, I'm simply going to conclude this beautiful session for parents. That what should a comprehensive to-do list would look like when it comes to preventing allergic rhinitis in children?
So preventing allergic rhinitis is not always completely possible.
Okay,
So what would I would like to talk more about is controlling the disease if it is there,
right,
and
right,
also preventing it at an early age by preventing certain exposures. So
right,
if the disease is already there, if the child is deemed allergic to certain substances, the exposure to those substances like house dust mites or insects has to be done.
right,
So the prevention measures which are given to the parents have to be followed strictly if possible.
right.
And regular visits to the clinician will let you know if the disease is progressing or not. The development of symptoms like respiratory difficulties or any systemic symptoms like
Okay.
swelling in the lips or around the eyes, difficulty in breathing, choking.
Right.
These kind of symptoms are really severe and have to be noted down. And
Okay.
if any food allergy is there, so labeling of all the food items, um prevention of even minimum exposure to that particular food item. For example, if a child is allergic to peanut, so the ingredients which are there for any snacks or any food items which are consumed outside the house, that has to be done very carefully. When the
Okay.
child grows, the child also has to be taught like what is good or bad for them. If the child is imparted the complete knowledge of their disease and the prevention measures, it takes a load off the parents also. The child
Right.
has to be taught that they have to avoid exposure to the house dust, they have to avoid exposure to the insects, they have to avoid certain food items which are causing the allergy. So all of the
Right.
knowledge has to be imparted to the child also. The child
Right.
also has to be given that responsibility and the power to make those decisions.
Right. So I agree here that, they usually say that prevention should be applied at home. In this case, it means literally that we have to keep our surroundings clean. We have to keep everything systematically so that they can identify and keep things different that could trigger the condition in and their child, in their children. So absolutely, I think parents simply need to understand and then probably
Right.
implement the measures you would suggest them. How
Right.
wonderful, sir. So, on that beautiful and very, very optimistic note, we really appreciate your presence with us today, Dr. Yash.
Thank you.
And I am hoping that the enlightening information shared, it will be valuable to many families, particularly working parents. So, thank you so
Right.
much for joining us. It's
You're
really been a
welcome.
pleasure.
Thank you.
And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again. Thank you.
You're welcome.